So, look, what I want to talk to you about today is kind of the journey of developing a national health leadership framework, why HWA got involved in that, what Health Leads Australia actually is, a bit about how we developed it, and something about meaning in practice. A lot of you will know a fair bit about Health Workforce Australia, so I'll try to just skip through a bit of basic background so that I don't bore you to death with that. But I want to start by acknowledging the breadth of changes and challenges that we all face. And the ones that are here are not necessarily, the only ones, or even in some respects the most important ones, but they are indicative of some of the challenges that we face and that really mean that we can't go on with business as usual. We actually have to find different ways to do things. And there's been a lot of work around the world recognising that if we just keep on with what was a brilliant idea, some time ago, and a brilliant health system that has served us well and has kept us healthy, then paradoxically, it's like all innovations, if it doesn't change, if it doesn't grow, if it doesn't adapt, then it will become an elephant that actually doesn't continue to serve our needs. So, Health Workforce Australia was established by COAG, the meeting of the Commonwealth of Australian Governments, and it was set up explicitly to really look at issues of the sustainability of the health workforce. So it is national, it's got a national brief, and it really is focused on, as most of the national health reforms are, on how we actually create a sustainable health system for the future. And of course, Health Workforce Australia's bit is health workforce, which is interesting because leadership's a bit more than that, but we'll come to that. So, that's a pretty big sort of goal. And its three key objectives are building the capacity to deliver fit-for-purpose health professionals more quickly and more efficiently. And there's a whole lot of, training gaps and the demand and supply and nurses who can't get placements and, there's a whole lot of problems with how we build the capacity of the health workforce. Boosting the productivity of the workforce, and that's not in isolation of creating creating all the kinds of improvements that will enable people to give of their best and for their best to be genuinely meaningful. And in some ways, I think when we get into conversations about productivity, people sometimes forget that that's what it's really about. There's just sometimes that association with efficiency that boosting productivity becomes, a less than fabulous phrase, but actually it is really about clearing everything, getting everything, all the systems working really well together so that we can all do our best job. And improving distribution of the health workforce. It won't be any surprise to all of you to know that the evidence shows, there's maldistribution if you're looking rural, remote, etc. So improving all of that. And forgive me, kind of sounding a bit dismissive in summary, but, they're big tasks. So HWA's approach to doing this, three key approaches. One is building the evidence base. And obviously enough, up-to-date researchers and planners have got to have good evidence. And in some instances, it's a bit surprising if you think. Health Workforce Australia has just produced the Health Workforce 2025. A lot of data about doctors, nurses, midwives, and I'm sure you'll have all heard about it in some fashion. And now, they're moving on to allied health. In some ways, you've got to think it's a bit surprising that we didn't have this evidence. And no wonder the health system's been struggling. So building that evidence is key. And so Health Workforce 2025 is the best known example, but there's a lot of other evidence-based work that's being done, including around, there's some publications on the HWA website around leadership. Working collaboratively. absolutely a key and critical way to move forward. It's taken quite a while, and it's just, in this audience, I think it's just going to be like, yeah, we know that. But the way health tends to work in silos and disciplines with, barriers about everything, it just has such a negative impact for the individual consumer, the communities we engage with, and for the health system as a whole. So working collaboratively is enormously important. And pretty much HWA tries to do that in all its work. So really from its inception, it was created as a gesture of collaboration, if you think about it. That's what that COAG, all agreeing, let's do it this way. So it has had its genesis in collaboration. It's trying to do that very strongly. So for example, in a recent a major project we're doing on health prescribing pathways, over 1,000 consumers were involved in that, actively involved in that. So the collaboration is not just with other national health bodies and with states and territories, but with professions, with consumers and communities. The third way in which HWA tries to achieve its mandate is by providing leadership. So obviously enough, again, given its mandate to build a sustainable workforce, it needs to provide some leadership in shaping the whole public agenda about workforce. And so it does that in a number of ways, with forums, with policies and so on. Promoting public debate is also something that HWA wants to do more of, and more in the ways that it actually engages members of the workforce and citizens, generally speaking. And so there's a whole lot of things in train now to increase and enhance some of that. But, in some ways, even things like having conferences and attending conferences are part of that. And then HWA has a number of leadership projects, and I'm managing most of those, and that's some of what I'll focus on and talk about today. So why focus on leadership? In some ways, if you think about HWA, focus on a sustainable workforce, why is HWA the best agency, and why are we focusing on leadership anyway? Research is really interesting. Research across many fields, but across health, shows that the quality of leadership is what gets you the quality of people satisfaction in the role, staff motivation, staff retention, the culture and climate of organisation, and the kind of outcomes you want in business. And there's plenty of research about all that, but I think at an absolutely practical level, you will all have many stories about why we need to improve our leadership in healthcare. I was told recently about a young graduate nurse who was one of a team of graduates. And, I'm not a nurse, so I won't understand the details of the story, but essentially there were a few young nurses, part of a team, that were responsible in the middle of a night for dealing with, a heart attack, I think, I can't quite remember, but one of those a person turns blue, an elderly man who was being washed, who was turned over in bed, and he was blue. So young nurses who were then responsible for, hitting buttons and getting everything happening. And, you watch television and those systems should be really clear, and things happen and it's all automatic and everything is in the place that it ought to be in. And for these young graduate nurses, it just wasn't falling into place like it was in television, and key instruments weren't replaced, weren't there. Key people didn't come at the time they were supposed to come. And so these young people dealt with this situation and were then the person who was responsible for the graduates and for debriefing them didn't come. Now that's just, one example of all the things that can go wrong. Now, interestingly, it was this particular young graduate who, sobbed with an elder advisor and got past the tears and made an appointment to go and see the person in charge and put forward some suggestions for improvement. And since then, things have started to change in that instance. But see that critical moment, there's one young graduate who, that must have been the most extraordinarily shocking and devastating thing, and to happen so young in your career. And we know there's issues in retaining young graduates. And this young woman, you'd have to think, has the makings of a leader. Because, there's a symbol there about leadership comes from any level. There she is, a young graduate who was prepared to front up, make an appointment, make some suggestions about how the entire system should be improved, and did it with such conviction that those suggestions were taken up. So, look, it's not only research and our kind of, common sense, practical knowledge that says we need leadership. In 2010, when HWA was looking at what would be its work program in this area of workforce innovation and reform, it held a national consultation. And people all around the country responded quite powerfully and in absolute agreement that there were 5 areas that HWA should focus on in this area. And I want you in particular to look at number 3. Leadership for the sustainability of the health system. It's really interesting, A, that it was so powerfully there, and B, that people didn't say leadership for the sustainability of the health workforce, they said the health system. So that's given us quite a big mandate. That was signed off by national ministers. It's part of the Health Workforce Australia work program, and so that actually gives us a mandate to go ahead and do this work. And one of the first strategies in doing this was for Health Workforce Australia to prepare for national agreement a health leadership framework. Now, for any of you who, your favourite bedtime reading is health leadership frameworks? Not? Okay. But you may have heard the NHS has a leadership framework, Canada does. There are a number of professional leadership frameworks. So there's a lot of frameworks happening, and most states and territories have some kind of framework that they use as the basis of their programs. But the idea was to get a national one happening, and then following that to do some developmental programs and for both, and some other work that I'll talk about in a while. So I was recruited to do this, all in 6 months actually. I was supposed to get national agreement to a framework, design and deliver a senior health leadership development program, and sort out the best models of leadership development for Aboriginal and Torres Strait Islander health leaders. Not surprisingly, I said I think it'll take just a little bit longer. So now, I said to Sam this morning, it's just a bit tricky talking about this because absolutely, as we speak at this moment, the HWA directors are considering the revised version of Health Leads Australia. What is here is the version that we took to consultation, and so I'll share that with you. And I'm sorry I can't share with you the slightly revised version. But today, HWA will make a decision. I'm pretty confident they will support it, but they will make a decision about, whether its path and how it goes forward to Australian health ministers. So the structure of this framework is there are 5 areas for focus. And the first letter of each creates an acronym, LEADS. We wanted something that was fairly readily memorable. So those are the 5 areas for focus, and it was really important to us in articulating what those were for, what the goal would be. because we knew if we didn't say what the goal was, some publicist somewhere would say it for us and would not say it as well. And in fact, I think the goal, so we've said healthy Australians in a caring, sustainable system. That has been improved with consultation, and the next version, I think is even better. So just to quickly give you the structure of it, the focus areas in the acronym create the LEADS part of Health Leads Australia. On the left, in the coloured bit, are the 3 capabilities, and there's 3 capabilities for each of the 5 focus for areas. And then we've got some descriptors, behavioural descriptors. So I'm not going to go through this in detail, because I think once we start talking about the capabilities, it's too much into the detail, and it's better you can see what those 5 big ones are. But this is what it looks like. And so the lead self is really about self-awareness, it's about self-development, and it's about demonstrating strength of character. Engaging with others, incredibly, incredibly important, because without engaging with others, little change actually happens. Achieving outcomes. Now, it's really interesting because a lot of people see this a bit as a management task, but I was asking Sam about how she came to be founder of APNA, and she was, it's a fascinating story. You've got to get her to tell you at some point. Basically, from a practice nurse working in isolation thinking, I want to have people to talk with, I need to belong to something, onto a journey of creating an organisation, and through that process engaging with others to influence outcomes. One of the things that struck me though, as I listened to her, was how very focused she was. She knew that there was a goal there, and that's really important as we think about leadership. It's about working with others to actually work out what the goals are, staying focused, being accountable, all the way along. Innovation is increasingly important. It's not innovation for innovation's sake. It's innovation where it is needed, where we need to make it to improve things. And some of the best practice awards that you're giving out have just got beautiful stories of innovation in them. And part of the challenge, I think, for us, because I think there's so many examples of really good innovation, but how do we then take the best of those and share them? How does an isolated example of something fabulous become something that everybody can use? And one of the other things is that innovation is, as you can see in your awards, not just about products. It's about a way of doing business. It's a way of providing care. It's models of care. It's how we design our future. And shaping systems, incredibly, incredibly, incredibly important in health. Because if you think about everything in health is interconnected. Peter Drucker, who's a management guru, 20 odd years ago said healthcare organisations are the most complex any human has ever tried to lead or manage. And he's not joking, and that's really well informed. You think about it, every single bit. You make a change there, and the changes ripple through. So for all of us, as we try to lead in any area, to actually understand how systems work and how we can break down silos, work in collaboration, etc. It's really important. So just briefly, there was the national consultation 2010. Then we did some research. We had a lot of stakeholders engaged, giving us expert advice, etc. We ended up, we looked at hundreds, literally, of frameworks, and we did some interesting discussions with colleagues in New Zealand. But we ended up, on the advice of stakeholders, really investigating, working more closely with either the NHS or Canada or both. In the end, we are working much more closely with Canada, and the LEADS is the same as the acronym in their framework, which is Leads in a Caring Environment. So the benefits of a national approach. Now, why bother? We've got a lot of frameworks. Well, we need to actually have a common language. Until we really know what the capabilities are that we're talking about to create the kind of lead, the change that we need, we'll always struggle. Critically, we can have so many really good things, but unless we can work together, we'll never agree on health leadership being, and what form it should take, being embedded in early career training and development, in relevant national standards, and in accredited professional development. So we went out to consultation, as I said, with 4 questions really. There were 4 things we really wanted to test with people. The structure and content. What did people actually think about the framework? Were the focus groups the right ones? We invited them to take the capabilities and the behavioural descriptions, tear it apart and give it back to us. Actually, there wasn't much tearing, I have to say. There was a lot of validation. We really needed to test the articulation. Where does it fit with existing work? Because if we just have to throw everything out that's already happening and then, start again, that's a waste. And I imagine that, like many nurses, you're not keen on waste. Well, neither am I. So we didn't want to do that. So we've had some really good guidance on that. We really wanted to test this proposition about should we be embedding health leadership development in early career education, training and continuing accreditation, and the answer overwhelmingly of over 700 people is yes, 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 that we should start as early as possible. And there's an interesting blog from one of the reviewers in the Harvard Business Review who says, why do we wait so long to start training in leadership development? And he's got some captivating stories about how kids are learning to lead. And then, of course, the other thing that we really wanted to ask people was, what do you need to make this useful? Because I have to tell you, I'm not a great Commonwealth bureaucrat, but I'm a fairly experienced practitioner in the community sector and in public health. And having, a glossy brochure that sits on a shelf does not do it for me, does not do it at all. And I'm told that this morning, I think you said something really wonderful that resonated with people about we talk too much and we don't get on and do stuff. And I felt like there was a very good chance that I'd been co-opted into creating a document that would involve us all talking a lot. And yet, if you're inside the bureaucracy, it's very hard to say to people who think that that's the product, that's it. So we needed to actually go out and get the views of 700 people. What does this need? And overwhelmingly, I can tell you that the message was people looked at the framework, they got completely involved in it, they gave us hours worth of feedback. But ultimately what they said is, we like the framework, we think you've got that right. Big tick, we're happy to run with this. However, the absolutely key thing is this must be implemented. There must be resources. Don't leave it sitting on a shelf. And I was like, thank you. Because, if you're trying to front up and say it to health ministers, much easier to say, well, 700 people right around the country said. So, national consultation, as I said, and that was with over 700 people. We held meetings with organisations. We had public forums in every capital city, not regionally, unfortunately. We had an online site that people could go to. We had written submissions, and some of you may know that there's a National Leadership in Aged Care project happening at the moment, and they were holding focus groups around Australia at the same time. So they took the framework out and also tested it. So, the 3 principles underpinning Health Leads Australia, that everybody owns leadership. We have to start seeing leadership in public health as a public good. There is evidence about the return on investment, although, admittedly there's always more work to be done. But it's important that there's not just one organisation that owns health leadership. And that will be one of the challenges for HWA and all our stakeholders as we move forward is how we create a collaborative structure to own it. And I don't have time to go into that with you here and now, but Canada's come up with a really innovative way of doing that. Some people, when we were in consultation, said, well, this framework is actually for leaders and developing leaders. How does that help us develop our total capacity of health leadership? And it is actually by building the capabilities of individual leaders and embedding professional development and nuancing all that training so it becomes part of the career journey for anybody in health, whether they're a clinical professional or working in support. And finally, that the person you are is the leader you are. There's a lot around the whole sense of competencies. People get a bit afraid that, we have to be narrowed in. This is a capability framework, and people can start using it actually as soon as it's approved, actually just as the basic document that it is. Those 5 focus areas and those capabilities that attach to them are enough for people to start thinking. For example, in engaging with others, am I aware of the impact that I have on other people? Do I know about how I influence? How can I engage? We can start straight away, and everybody will do it differently. Some people think that it's really interesting, there are some people who think that leaders are senior, white, males at the top of the professional tree. Some people think that leaders are the people who are noisiest. Some people are afraid that because they are quiet and thoughtful and reflective, there is no place in leadership for them. Actually not true. And each person will find the way to express those capabilities. So, what makes leadership in health different? Leadership has similar characteristics kind of wherever you are in any environment. But in health, the outcomes, the focus on birth, quality of life, death, care, the balance between the needs of the individual and common good, the complexities of the health system are all nuances that create a bit of a difference. Leading in health absolutely requires courage. I'll go back to that other slide in a minute, but I just want to bear with you on this. What we've said is health leaders engage with others to influence the quality of care for birth, illness and the end of life, and for improved clinical and quality of life indicators and the overall well-being of the health system. So we're not trying to say that health leadership is in every instance different from leading in any other industry. There are a lot of commonalities. But the complexity and the focus in health are things that I think might be picked up in the discussion that happens. Courage, balance and evidence. It is not ever an easy thing. Some people worry about the distinction between management and leadership, and that's a whole another conversation we're not going to. This is about leadership, not about management. But by and large, most researchers and theorists accept that management is about doing the very best you can do with the status quo. Leadership is about asking, is the status quo the right one? And if it's not, about starting to change. Now, the moment the moment you start questioning, you need courage. And there are so many stories in healthcare of the courage that it took to be persistent. Think about the nurses in South Australia and Port Pirie trying to argue about the lead levels from the smelter. How much persistence and courage and endless, checking out the lead levels of kids and keeping documentation and putting up with, sometimes in some areas putting up with the whole, disapproval of your community. It does take courage. So that's one of the things that I think is worth thinking about. The other thing about leadership in health and about this framework is that this is not about how CEOs lead. Yes, it is about how CEOs lead, but it's about how all the rest of us lead too. Because actually, if the goal, and this is why the goal was so important to us, if we work out what the goal is, and the goal is about, you know, a people-centred health system that is equitable and effective and sustainable. If that's our goal, and I've just given you the words of the new goal, if that's the goal, then it's going to take everybody, and it's going to take consciousness at every level. And so the cleaner in a hospital becomes as important as the CEO, because in affecting that, it is important. So this is about at all organisational levels for anybody who has the desire and willingness to lead for improvement. The other thing about it is that this framework recognises that we can all be leaders and we are all followers. This was a very threatening notion for some of our, you know, very senior, august, elderly, high-holding position type people who said a few times, if everybody's a leader, who are the followers? I thought that was a pretty cute line, because the answer is we are all followers, including, at times, you. So that's our proposition about leadership in healthcare. This was not somebody who came to the consultation, but I went to a seminar just at a moment when I was thinking, I want to hear somebody talk about leadership, the bit that really lifts my heart. And so this is George Servidis, who's the Managing Director of Medibank Private, and he's Chair of World Vision. And he said, leadership is about lifting the heart, unlocking the passion for the purpose and making it relevant to the next generation. Leaders who inspire their team to take on the cause, who tap into passion and emotion, are the ones who unlock the energy and creativity and innovation. I thought that was pretty cool, actually. Leadership is sometimes much more prosaic than that, but I think he's got it. So the next steps, as I said, Health Workforce Australia directors are considering right now what the future of this is. They will make a decision about the manner in which this goes to the Standing Council on Health, which is all the health ministers in the country. And again, I'm not a bureaucrat. Rosemary Bryant could tell this to you in fine detail, but they may decide to send it up for approval or to send it up for noting. Basically, in terms of whether we get national agreement, it doesn't matter which of those happens. The single difference that really does matter is if it goes up for approval, then it's embargoed and I can't amend this slide to make sure you get the new copy. If it goes for noting, then they've asked me to make this available to you all, and I'm happy to do that, and the new version will be pretty much immediately available. Now, the implementation, there's a massive scale of work, and one of the most exciting things for me in the consultation was everybody wants to be involved in it, and there's so much, interest in working together in quite innovative ways to make this happen. So the first things are about the framework sits there, and that, can start being used immediately by individuals and organisations. But it would also be helpful for a whole lot of reasons. If, say, for example, on the lead self, and there are 3 capabilities, there were 3 or 4 workforce levels and measurable behaviours attached to each of those, and some really good case studies and examples so that people can go, that's how it works. Lots of tools are needed to, really make it useful in all the ways that it possibly can be used. Including embedding it, providing guidelines for leadership development programs and for actually trialling some of those. Lots of work that will continue happening with universities, the vet sector and the accreditation authorities to actually get this embedded in learning and in accredited continuing education and in some of the relevant standards. And the CEO of the Australian Health Safety and Quality Commission, but I got that the wrong way around, has said she thinks that it may be appropriate to embed this in the governance standards. And certainly that was some of the feedback we got from people in consultation, that there are a lot of national standards and it would be good for this to be embedded in so that it can help become an enabler, and so that instead of it becoming yet another thing that everybody has to tick off on, it actually helps be something that brings things together. And then the main thing we've got to do is use it and improve it. And, you know, I think that one of the things that I'd say is that leadership is always about a work in progress. Whether we are improving ourselves or we're improving, you know, a framework or the model of care, it's all about keeping going. So I'm not precious about this. It's been an enormous privilege to be involved in it and to help get it started, but now it's out there and I hope it gets used and gets changed and becomes something really fabulous. Thank you.